Welcome to this episode of DMC Medical Matters. With us is Dr. Roy Elrod, an emergency medicine physician at DMC's Detroit Receiving Hospital. Dr. Elrod, thanks for joining us.
My pleasure.
And I know here at the DMC we've put in place a number of safety protocols as it relates to COVID-19. What can patients expect when they come to the DMC for emergency care?
Great question. I think patients in this community can feel very confident and safe that they're coming to a place that we've taken the necessary precautions to ensure that they can come in here a very safe visit. And it's so important that you ask that question because we're aware that people are hesitant to come to the emergency department given the conditions we have in the pandemic. But I can assure everyone that we've taken the precautions to ensure that when they come in, first of all, they're screened, everyone's screened for temperature, and they ask questions about particular exposures. If they aren't masked, right away they're masked, and then we're able to segregate them into a place in the emergency department away from any potential COVID patients. So it's very, very safe.
Now, I know we're in the middle of an uptick in COVID-19 cases all across our community. How important is it for people not to delay the care they need to get?
And again, another excellent question. What we noted, particularly with respect to that delay, is that patients that we know in our community that have diabetes, heart disease, they're afraid to come into the hospital with their conditions because they're afraid of getting COVID. However, that delay, that critical delay, allows them to get sicker than we want them to be. And so instead of them coming in with conditions we can treat right away, they become much more serious. And then that ultimately has them in a much worse condition. So we want them to be aware no one should be delaying if they're having conditions that they know can be exacerbated for them.
Now, to drive that point home, give us an example of something you may have seen in the emergency department that shows what can happen to you if you delay the care you should get.
Classic point would be a person with known heart disease, been taking their medication, and then all of a sudden they start having some chest discomfort. And instead of believing it could be chest discomfort due to their heart, they may say, oh, it's just an upset stomach. Oh, it must be, and begin to delay. By the time they come to the hospital, what could have been just a minor heart condition now becomes something more serious, and they many times have to go to the ICU. And that's so unfortunate because it's preventable. We're able to care for them if they come in when they get those immediate symptoms and take care of them appropriately in a very safe condition.
As we wrap this up, what's your take-home message for people who might be watching this today?
Let them understand that the DMC has done everything that they think is important to ensure that they can come here and have a very safe visit and get the care that they absolutely need when they need it. So don't delay.
All right, thanks, Dr. Elrod, and thank you for watching. For more episodes of DMC Medical Matters, visit our website at dmc.org.